Welcome, everybody. My name is Becky Bean. I am a member of the board for the Lupus Foundation of North Carolina, and I'm really excited to really kick off what I'm hoping are going to be a series of sessions, really connecting the lupus community to resources available to them. So I am joined today by two phenomenal panelists who I will let introduce themselves. And our topic of discussion today will be all around vocational rehab and services that are available. So I'm going to start with Anika. Why don't you introduce yourself to the group?
Hi, my name is Anika Page. I work with vocational rehabilitation under the Lumberton Unit office. I am the counselor in charge over the Laurinburg Satellite office with vocational rehabilitation.
Awesome. Thank you, Anika. And we also are joined by Kayla Britt. So, Kayla, do you want to introduce yourself to the group?
Hi, I'm a 20 years lupus thriver. Sorry, couldn't get that out. I'm also an assistant attorney general with the North Carolina Department of Justice. So I'm excited to talk about my experience.
Awesome. Well, Anika, I really want to start with you. So, can you share with the group what is vocational rehab?
Vocational rehab, basically, we help people that have disabilities to achieve their goals for employment and independence. So if someone has a disability that prevents them from achieving success in their career or being independent in the community, then vocational rehab can connect them to the services and resources to help them meet those goals, basically.
So, tell me why do you think this is important for lupus thrivers to be aware of vocational rehab services?
Um, I think it would definitely benefit lupus survivors because VR promotes employment and independence for individuals with disabilities through customer partnerships and community leadership. So basically, we help individuals with disabilities starting at age 14 up. We don't have a maximum age. We can assist these individuals with preparing for jobs, finding a job. If they have to have surgery or something and return to their jobs, we help with that. If they're on a job and may need some type of accommodation, things like that, we can also assist with that. And even helping people advance in their careers, if vocational rehab can sometimes do that with training and other opportunities that we can provide.
Wow,
Basically, our focus is on individuals' abilities and providing new possibilities for them.
that's
We
awesome. Yeah.
we explore what their interests are, look at their abilities and aptitudes, establish an employment goal with them, and then we plan the services that they need to reach that goal.
It sounds like it's very personalized, based on
in-
what are the needs of the
Individualized
individual.
for each person. So no two people basically receive the same services because it's based on the needs of each individual.
Well, I want to pivot to Kayla. So, Kayla, I'd love to hear your story. How did you first learn about vocational rehab?
So I was in high school and I had asked to go to the restroom. We had a substitute teacher. And the substitute teacher was like, no, like you have to wait till after class. And I was like, well, I kind of I have a kidney disease, so I can't really hold it. And so she sent me to the bathroom. And when I come back, she was like, have you ever heard of VR? And I was like, no, what's that? And so she kind of gave me, a short little spiel about what it was and was like, go home and tell your parents they need to sign you up for VR. And so I went home, we talked about it, and like we immediately started the process.
How old were you? What year were you in school, Kayla?
I want to say I was a sophomore or a junior. It was definitely before my senior year because by my senior year, I think we had all the ducks lined up because we wanted to make sure that VR had everything that they needed to be able to review and complete my application.
It almost sounds like the earlier the better, right? The sooner you know
Absolutely.
that you could be eligible for services, they can connect you in at the right time. So tell me a little bit about the application process. What was that like for you, Kayla?
So it's been a long time for me. So I don't remember a whole lot about the application process. And I'm sure that there were parts that my parents handled instead of myself. But I know that there's a financial need component. So we had to provide pay stubs, maybe taxes. Anika can jump in and kind of clear that up for us. But I also provided documentation of my disability from my physicians, as well as any type of accommodation that I was currently receiving while I was in high school.
So, Anik, I'd love to flip to you. So, tell us a little bit more about how somebody connects into the application process. What does that look like?
The application process for vocational rehab, um, with students like Kayla, a lot of times VR counselors like myself, we go out to the schools and try to um, talk with counselors, teachers, social workers, nurses, and get those referrals on those students that may require our services, definitely as they're transitioning from high school to the real world and having to make that decision of what they want to do once they graduate. And we have services that, can assist with them making that decisions. We can do assessments and things like that to help them determine what careers are available, what their interests are, because a lot of times they just don't even know, what they truly want to do or what they're capable of doing. So, vocational rehab, we do have a lot of resources and things that we can use to help them make those decisions clear. But basically, the application process, how to apply, um, most people they to qualify, you have to have a disability, which can be a physical disability. Examples of that are like amputation, cerebral palsy, diabetes, uncontrolled diabetes, even lupus, is considered a physical disability. Then you have your learning disabilities like intellectual disability or specific learning disorder. We have developmental disabilities like autism, ADD, ADHD, things like that, mental emotional disabilities such as alcohol, substance use disorders, bipolar disorder, major depression. We do have hearing loss and vision loss as well, because we do have services for the deaf and hard of hearing and services for the blind that are all connected, with vocational rehab and basically provide the same type services. Um, and basically, they have a disability if they can't find or can't keep a job due to the limitations that the disability causes, or if they receive SSI or SSDI, they are actually automatically presumed eligible for services. So basically, like Kayla said, once we do the application and get their medical documentation, we determine eligibility, and then we have to figure out what their limitations is by doing guidance and counseling and discussing, what concerns they have with a job or what issues they have if they've ever worked on a job, and we try to find suitable employment for them. So something such as, we don't want someone that has issues standing for long periods working at a cash register or something like that where they have to stand for 8 hours straight on a day.
Makes a lot of sense. Well, is there a eligibility criteria around financial capabilities, or is it simply if you have a disability, you are eligible for vocational?
So the disability and the limitations make you eligible. But if you want to apply for cost services, like with Kayla, for instance, she went to college. If you want to go to college, we do have to do a financial needs survey.
Okay.
Which with the financial need, if you receive SSR, SSDI, you automatically meet financial need. We don't count anyone else in your household income or anything like that. If it is a student and they don't receive SSR, SSDI, then if they're 23 or under, we do have to count household income, their parents, whoever's supporting them. If they're over the age of 23 and they don't have income, but they're dependent, we do like source of support if someone's providing
Okay.
shelter for them, food for them, things like that. We can do a source of support, and based on that source of support, they will meet financial need as well.
So you mentioned SSR and SSDI. Tell me what that stands for.
SSI is Social Security benefit
Okay.
for individuals that most of the time SSI, if they haven't worked or been unable to work, like a lot of youth that are disabled, they receive SSI, and they do have to be redetermined once they turn the age of 18 as an adult because the requirements are different as an adult than as a child.
Okay.
SSDI is normally given to individuals that have worked and for some reason have been determined disabled, and sometimes even dependent children of individuals that receive SSDI can receive that benefit as
Okay.
well. But
Super
if they're
helpful.
receiving it as a dependent, then if they don't have a disability on set date, then we can't use that for presumed eligibility.
Okay. You mentioned referrals from
Mhm.
guidance counselors, teachers. So it seems to me there's a lot of work to be done from an advocacy perspective just to raise awareness amongst
Yes, it
those
is.
groups because a lot of disabilities aren't visible. Like unless you ask the right questions, you're not
Right,
gonna
you
know.
can't see them.
Exactly. So I'm curious, is there also a pathway to self-refer? Like could somebody literally go to the website, and identify where to click to start the application process?
They can go online and just type in North Carolina vocational rehab, and our website will come up. We are under the division of Department of Health and Human Services, but our website will come up. On that website, there are so many tools to help you understand vocational rehab, what services that we provide. They have publications, they have frequently asked questions on there, they have a link to find every VR office. There's a office close to every county in the state of North Carolina. And most other states, if someone, is watching and they live in another state, they can just search vocational rehabilitation services and get the information on our services. So
Awesome.
definitely, if they can just search vocational rehab, Google it, and put the city, and the closest one will most likely come up, and they can just call in and state that they're interested in VR services,
Nice.
and we will complete that referral form. It will be assigned to a counselor, and that counselor will reach out to the individual to begin the intake process.
Awesome. All right. Well, I want to flip to Kayla for a minute. So, Kayla, you just have such a amazing story, and so I'd love for you to share a little bit more about what actually did you receive, what services did you receive, and how did that set you up to accomplish your goals?
Yeah, so I was diagnosed with lupus at age 11, and I also had lupus nephritis. So I took chemotherapy for 2 years, a period of 2 years, to treat that lupus nephritis. So there was a lot of talk amongst physicians and family and stuff. They thought that I wouldn't graduate high school in time because I was out too much. Like I just missed too many days. But I was that kid who was doing homework from a hospital bed, and like my doctors would sit on the edge of the bed and help me with my math. And so that's just kind of a picture of who I was as a sick child. And then when I was presented with this information, about VR, I knew I wanted to go to college and I knew that I wanted to obtain a professional degree. I didn't know what that would look like for me. Um, Lupus flares up with stress, amongst many other things, and I knew that school would be stressful. So finding VR allowed me to receive services, such as accommodations in school. So if I needed extra time testing, I could have that. So if I needed to get up and go to the bathroom in the middle of an exam, I wasn't losing important time. If I needed to take a medication at a particular time of day, I had that ability to step out, take that medication, and come back in without that going against me. And the same thing for absences. I had a little bit more flexibility when it came to absences, so long as I was not missing important work. Um, I also was able to carry, um, so I had a different set of books for home and at school because I was not physically able to carry the books on my back. So VR was very instrumental in making sure that that was available to me. Um, there were also times when books were available on CD, so that they were more easily accessible. And then there was like the more financial components. So VR was able to pay for my housing during college and in law school. They were able to pay my tuition, my books, and fees. And I think there was a short period of time when they even paid for like groceries and gas. And I think there are, certain parameters around that. So Anika could speak more about that. But VR really made it financially possible for me to go to college and for me to become an attorney. And I'm forever grateful for that opportunity. And so when I tell my story to folks and I mention VR and they don't know what I'm talking about, I'm like, we have to talk because this is like a hidden treasure. And it's so important that not only people with lupus, but people with any type of disability, it's important for them to get this information so that they can get those services, because it would be a shame to know that someone who has that desire and that ability to accomplish such great things are being held back because they think they can't do it, because they don't have the support to do it, or they don't have the means to do it. And so I think that's where VR comes in and can really change a person's life, just like they've done for me.
Absolutely. I'm so curious. It sounds like this was instrumental, right, for you to be able to be on the path to going to college, to getting your law degree. So there's some time sensitivity around the application process. So Anika, talk us through, I think you said 14 was the age cutoff, the younger side of the
That's
age
where it
cutoff.
starts.
What's the time frame? Like how quickly do people need to be referred so that it could be a part of their planning for college? What does that look like?
Definitely with students, I feel like we definitely try to get them junior year if possible, just because so they can get those core services that we can provide to individuals. We have pre-eds is what we call them now. I don't think we had them really when Kayla was there. We provided the services, but they didn't really have a name. But like with the high school students up to age 21, long as they are enrolled in school, we have what we call pre-employment transition services. And that's basically we provide workplace readiness, self-advocacy, job exploration, post-secondary training, which Kayla fell up under, and then the work-based learning. So those services are specifically for those younger age students that are interested in vocational rehab and getting that foundation to help them when they do go to work so that they can maintain employment, and also, to make them aware of jobs, because a lot of people don't think outside the box. They usually think about jobs they see other people doing and things like that. So to have someone, especially like Kayla, that was designed to be an attorney, and to see her reach that goal through VR, I mean, it's just awesome, to know that we could help someone do that.
It has to be so rewarding, right? To
It
hear
is.
Kayla and her
That's the
story.
best part of my job is seeing individuals such as Kayla, come in and they have this goal and it's like, oh, that seems so far away. But then to see it actually happen, it's an awesome thing.
Yeah. Well, tell us a little bit about, I think there's some different pathways, and I think we talked about how personalized
Mhm.
vocational rehab can be. So talk to me a little bit about different pathways, college pathways, trade pathways. What does that look like for people who may have different goals?
So yeah, based on once we do, their application and do the interest inventories, if they're not sure what they want to do, and we determine their job goal. So, for instance, if they determine something like a welder, that's more of a trade. It's a short-term training or truck driving, maybe certified nursing assistant. Those type classes are offered either through the community college or through like specialized training facilities, truck driving schools. things like that. We do actually have a training facility in Goldsboro called WorkSource East that offers programs that even for individuals with intellectual disabilities, so that they can, get these jobs and not even have to go to the community college and take a lot of those, general courses like the Englishes and the maths. It's a more hands-on program for them. And I mean, they offer carpentry and welding and childcare and groundskeeping, um, food services. They offer so many different programs. And there they have actually a facility where if a student is enrolled there, they have housing and all of that. And vocational rehab, helps those students go through that training and just seeing the success, because so many people are always told what they can't do. And with VR, we're that one group that's there telling you, okay, this is your goal, and we're going to do whatever it takes to help you reach that goal. So it's definitely a rewarding process. Kayla, the other choice is people determining they want to be something that requires a bachelor's degree or a master's degree. When we set that job goal, when we do your plan, we're planning everything that you will need in order to reach that goal. So, like Kayla's goal as a lawyer, her goal was set. So we already knew, okay, she's not going to stop at a bachelor's degree because she has to go to law school. So, all that was planned from the beginning. And then, like she said, with her living off campus, VR was able to assist her with housing and with housing and food, meals. We can support meals when they live off campus. And I think she did have a special situation where we did help her for some months with being able to travel back and forth and things like that. So VR is individualized, so it's based on each individual's needs. We try to support each individual that is eligible for our services and provide whatever they need to be successful.
Anika, I'd love to hear from your perspective. I mean, you probably are seeing these applications, every day. This is what you do.
Mhm.
Is is it mostly younger folks like Kayla's situation, or maybe give us some examples of folks that get connected later on in life where this really helps them with job placement? I think it'd be great for people who may be in later seasons of life to put the dots together around what vocational rehab can do for them.
We have all ages. We have people come to us late 50s, 60s, that are unable to do the job that they've been doing for 20 years, and maybe they've had to have back surgery or, some other condition that happened that they're no longer able to do the job that they've done. So they come to vocational rehab, and we help them start over. Basically, we have to determine a job that they're capable of doing now due to their limitations, and we try our best to find them a job that is suitable, that even if they need accommodations, we'll make sure that they get those accommodations in order to be able to do the job that they're doing.
I love the concept of if you can dream it, we'll figure out
Yes,
how to get
you
there,
can
right?
achieve
That's what
it.
I'm hearing from both you and
Yes.
Kayla, which is just it just inspires a lot of hope. So
It
I'm hoping
does,
that
it does.
our listeners are going to get that. So Kayla, I'm really curious. Did you know that like pursuing a law degree was what you wanted to do, or was part of this process helping you kind of laser in on a certain goal for yourself?
So I wanted to be a pediatric rheumatologist because
Of course you did.
I wanted to help kids who were like me. But I come to make the decision that being in a clinic or hospital environment probably wasn't the best situation for me. And I quickly fell in love with the courtroom after a short experience of being able to be inside the courtroom and experience that. And everything just kind of came together at one time. And I knew that the path that I was on was not the path that I was meant to be on. So when I changed my major to criminal justice to go to law school, I already had in my plan that I wanted to go to professional school. So it didn't change my plan at all. It was just a matter of I was changing subjects. So no, I didn't know what I was going to end up doing, but VR made the transition seamless. It was not an issue for me, and it allowed me to jump into that professional role without worrying whether or not I would have the support, or worrying about whether or not I would be able to be accommodated, because I knew that VR has the services, they know the law, and they will support me as I move forward as a person with a disability.
Yeah, I would imagine some people maybe aren't as laser focused. And so part of it could be just opening eyes to what the possibilities are. I'm
Definitely.
hearing Anika describe all of these different personalized services, and I think that could certainly be a benefit. Anika, tell me a little bit about CAP. What is CAP and why is it important to this discussion?
So CAP, it was established basically under the Federal Rehabilitation Act of 1973. Basically, what CAP does is they serve as an integral part of the rehabilitation system. They assist with advising and informing clients of the services and benefits that are available to them through vocational rehab. They assist and advocate with the individuals if they have needs. A lot of times we do have policy, but sometimes, policy is not clear, it's not straight black or straight white. So sometimes clients may ask for services, and a lot of times CAP can come if we can't resolve the issue with the client. They're always notified that they can contact Client Assistance Program, and they kind of advocate between us, and they help us to locate resources and things like that that we as counselors may not know, because they do a lot more research on different situations. I'm thinking, Kayla, did you have to contact CAP with the situation?
Yeah, I contacted CAP a few times. So for me, I found that because every plan is so personalized, and because I was taking a path that was very different than most VR candidates, there were several times in my journey where the counselors that were in charge of my case had never seen this before. So I'm asking for particular things, and they're either telling me no or they're not sure. And I'm like, okay, well, your policy doesn't say that, or this is what your policy says. And so we learned very quickly that CAP was a resource to get around those gray areas. And it was never about VR not wanting to provide any type of service, or a counselor not wanting to provide those services. It's just that the individualized plans call for such a wide range of things that if it's never been an issue before, then it's not going to be in policy. Like it's not present because it's likely have happened for the program. So I think that by reaching out to CAP and clarifying different issues, and coming to resolutions, I was able to get better services, and it was a learning opportunity for the counselors in Lumberton.
And probably improved services for future. I mean, maybe this was the first time that came up, but there could be future VR candidates that would benefit from the services, right?
Definitely.
So, Anika, I think you mentioned you were in Lumberton. So, are there Anikas in every county across the state of North Carolina? What is that like?
Well, there's an Anika in Scotland County and an Anika in Robinson, because I work in both counties. But yes, we do have some awesome VR counselors, and their goals are, to help our individuals that come in reach those goals. Of course, every counselor is different. I've been blessed to have some awesome clients like Kayla, and helping those that set those difficult goals. It's definitely a learning experience. She was actually one of my first in my group when I became a transition counselor. I think I got Kayla on my caseload, and it helped me learn a lot as a young counselor, how things work with VR and things like that. So it definitely brought growth to me in my career, by having that experience with her and helping her to reach that goal. Because, like she said, that's a rare goal that we see individuals with vocational rehab to set.
How many years from when Kayla first applied to when she graduated with that law degree?
Oh wow! Because I started
A
2009.
lot of years.
Yeah, it was a long time. Because I think when I first started, she was already in getting her bachelor's degree when I became her counselor.
So it was a 10-year period for me.
Yeah, you were at Campbell, and then you went to North Carolina Central and worked on that. But yeah, it was a good process. So I definitely enjoyed the experience and just learning. Every client, every day I learn something new. You think you know everything when you worked for so long with the agency, but with vocational rehab every day, it's like I learn something new. I find new disabilities that I wasn't aware of, and the limitations, and being able to say, okay, we can do this, and this will be able to help you be more successful on your job. That's rewarding, because a lot of people feel come and they feel like, well, I can't, they don't necessarily qualify for disability services, but they still have limitations to work. And being able to help them, be self sufficient, it's rewarding for sure.
I bet. Well, Kayla, I'd love to hear from you just around, your goals for today. Obviously, I'm grateful that you all were willing to be participants, but what's your goal? What would you like for the listeners to get from this conversation?
So for me, it's really important to promote the fact that a disability is not an inability. So, like, just because you have lupus, for example, does not mean that you can't achieve any goal that you have for yourself. It might be harder, and it might take longer, but you do have resources available to you. And if you take advantage of those resources, you would be surprised at where you might find yourself. And I am forever grateful to Anika, because she was so patient and kind to me on my journey. She cheered me on. Like, I always knew that I had a supporter and a friend in Anika, and I think that will probably be lifelong for us. Um, and I just want to make sure that the word is getting out about VR. I didn't learn it from a high school counselor, and I should have. So it is important to me that the schools are getting the information and giving it out. And I don't want to see the information only being given to folks with IEPs, because there are people who need the services who do not have an IEP. So I think that the information should be distributed to all students, and it's up to the students and the parents to reach out to VR if they don't have a plan in place. Um, I encourage professionals, patients, caregivers to spread awareness, whether it's job related, whether it's college related. Just put the information out there so that more people can benefit from the service.
Yeah, absolutely. Anika, I'll ask you the same question. What would you like people to get out of this conversation? Anything to add to what Kayla shared?
I would just recommend, if anybody, if they feel like they have a limitation to work, and they want to get help finding a job, whether it's just going straight to work, or whether they would need training or retraining on that job, just take the time, call vocational rehab. The process is not a quick process, because we have to get your medical records. We do the assessments and things like that. But once we set that goal and we're working towards that goal, as long as the client, you are doing your part to participate, vocational rehab is going to be there to support you and help you in every way that we can, to be successful. So don't be afraid, to make that phone call and just find out, more information about your local VR and what we can actually help you do. On our website, the policy is on there. Kayla was one of those, that law student. She would go online, find the policy, and find the information herself. And she'd be like, "Well, policy says this," and I'm like, "You're correct,"
You
So
chose the right pathway, Kayla.
yes, a lot of people wouldn't do that, but I mean, we do our best to provide services, but in some instances, yeah, we have to go to policy a lot to make sure we're doing what we're able to do. So yeah, vocational rehab is an excellent unknown silent treasure, as Kayla called it, and please just share the word. Anybody that you know, not just, individuals with lupus, but anyone that you talk to that has limitations to work, tell them about vocational rehab. That's how the word will get out if people share it.
I'd love to ask both of you another question. How can the Lupus Foundation of America, the North Carolina chapter specifically, support the work? What do next steps look like post this discussion?
For me, I think having a quick access to VR on our website would be very beneficial. So that if someone is on the website, specifically new patients, I think tend to gravitate toward the website. Let me learn all that I can learn about lupus. If that information is readily available on the website, I think that we might see a little bit more traffic in terms of folks with lupus. But also, I think continuing to have discussions like this and making people question what is VR. Like, I don't know what that is. I think that's important, and I think that the Lupus Foundation can promote the information, but it can go further than just the Lupus Foundation. Like, you're a pharmacist, you can take that to the world of pharmacy. I'm a lawyer, I can take it to the world of law. We can expand this information so far just by having the support of the foundation, putting that information in front of people.
Absolutely. My network becomes your network, becomes Anika's network. There's so much opportunity there. Anika, anything to add?
Um, yes, I would. I think that's a great idea of link, putting that direct link to vocational rehab's website on the page so individuals can click on there and there's a wealth of information on the website. So, and it gives you the list of all the VR offices in North Carolina. So it'll be easy for them to just pick up the phone and call to do that referral, give their basic information, and then after that, basically the counselor does everything else, partnering with the client. So it's not a difficult process for anyone to start receiving VR services. It's just taking that time to reach out and, of course, participate, come to your appointments and things like that. But VR is individualized, so never be afraid to ask for what you need because there's never, if you don't ask, you won't ever know. So just take advantage of this program that was designed for individuals with disabilities and limitations to work and reach your goals.
If you can dream it, you can make it a
Yeah, you can
reality. I
achieve
love
it.
it.
Yes.
And I love the idea of leveraging the foundation. I mean, we really want it to be a one-stop shop for resources. It's overwhelming enough to receive a new diagnosis, so to have one place that people can go to find a ton of resources for support, I think is a really good idea. Well, I guess I'll close out with just any closing thoughts, anything I didn't ask you that you want to share. So Anika, I'll start with you and then we'll close out with Kayla.
Um, No, I think we pretty much covered all the basics of vocational rehab. And if anyone has any questions, course, they can reach out to any vocational rehab office. If they have questions for me, they can call the Lumberton or the Laurinburg office of vocational rehab and ask for me. And I definitely, will try my best to assist in any way that I possibly can.
How about you, Kayla? Any closing remarks?
Yeah, I mentioned about new patients checking the website, but then I thought about, well, what about those of us who don't check it as frequently because we've lived with it for so long? And I think for that audience, I would like to see this discussion and more information about VR posted to social media sites that we're more likely to see in like a random, regular day without having to go specifically search for it.
Yeah, I love it. Leverage the power of social media to reach
Yeah,
a broader audience. I think it's a great suggestion.
definitely. Share videos. They show all the other funny videos, but this is very informational, so it should be shared as well.
Absolutely. Well, I want to, on behalf of the foundation, thank you, Anika and Kayla, for being willing to join as a panelist, sharing your story, all of the amazing work that you guys are doing, Anika, to support not just the lupus community, but all persons with disabilities, abilities to really find their own personalized pathway to achieve their goals. So thank you guys for joining today. My hope is that we'll get feedback on these sessions, and hopefully this is the first of a series of sessions just around various resources that can be available to the lupus community. So thank you again, and we will talk soon.
All right, thank you.